Get the care you need without the middleman copays or surprise bills. Dr. Eric Stonick, Chief Medical Officer of DoctorsNow, is here to explain the benefits of direct primary care and the services they offer. First of all, what is direct primary care?
So direct primary care is one of my favorite topics in healthcare, one of my favorite things that we're doing at DoctorsNow. So when my brother David and I first took over these clinics just over a year ago, our dream has always been to provide access and transparency back to primary care. I think a lot of people, a lot of patients have difficulty navigating the healthcare system, so we try to make it easy for them. So what direct primary care is primary care, everything you would get at your traditional primary care office, without the insurance. So insurance doesn't necessarily have to be a requirement to have primary care. A lot of stuff that is involved in primary care is predictable events as opposed to unpredictable catastrophic things. So we cut out the middlemen. There's no copays, no deductibles, no surprise bills, and we try to bring access and transparency to our patients at DoctorsNow. And I think we offer a good amount of services in direct primary care that people will find valuable.
What are some of those services that people probably need a lot, you see a lot of?
Yeah, so at your family doctor's or your family provider's office, you'll get an annual physical, and they'll do some blood work to look at your metabolic markers, talk about cancer screening and vaccines and stuff like that. We want to offer all that. A lot of the medications that you may need for cholesterol management, blood pressure, mental health, stuff like that is all included in your plan. Direct primary care is just a basic subscription every month, and you come in and see your family provider whenever you need to. All of your blood work is included, so there's no surprise bills with that. X-rays as well. And then at DoctorsNow, we've always done urgent care, and if you get sick, get a laceration, something like that, you just come on in. We don't have to collect a copay up front. You're not going to have to meet a deductible or anything like that. We just come in and take care of you, and that's how a lot of our doctors like to do it, and we think patients like that too.
So is this a replacement for health insurance then?
It's not. So direct primary care is not health insurance by name. I think one thing that we offer is that functionally it is a form of health insurance in the event that people do get sick or have an accident. So for example, one of our direct primary care patients was doing some work at home, had a bad laceration on his hand. A lot of times you need to have health insurance to get treatment for something like that, but he just comes in, we check him in, we irrigate the wound, sew it up, comes back in a week, we take the stitches out, and that's all there is to it. So in a way it can function as health insurance, but by name it's not. So some individuals and some employer groups just offer direct primary care to their employees, or some individuals just elect for direct primary care. Other people like to have a wraparound high deductible plan in the event of unpredictable or catastrophic events, and then have direct primary care at the centerpiece of it, and a lot of times that's able to help keep your costs down. The payment for direct primary care is a fraction of what most people's premiums are for their health insurance, so it's a good way to help save costs as well.
And how is that affected? Is it the care improved, the same?
Yeah, so direct primary care gives access and it gives transparency, and so a lot of times people have to wait a long time to see their family doctor, and if something does happen, they're going to the urgent care. But we offer both of them here, so a lot of times the family doctor who sees you for your annual physical is also the one who sees you when you get sick, and we have a better idea of what your overall health looks like, and that helps us to influence our decision making for you in the event that you do get ill, have an injury or something like that.
Well, thanks so much for being here to share this with us.
Yeah, thanks for having me.
And you can learn more, just go to DoctorsNow.com or call 515-471-1860. You'll find locations in Altoona and West Des Moines, and you can see more on social media.